My name is Faithimath. I'm a fourth-year medical student. I think the first thing I felt as a child, I think I went straight into denial at first because I didn't really want to believe it, or I thought I could hear my dad's voices and that, okay, he's going to come back. And that was the very first reaction, actually. So my dad passed away with liver disease. And the first time I went into hepatology, I saw the patients and it took me straight back to when my dad was really unwell, and I started relating the patient's symptoms to my dad's symptoms. And to see the patient's jaundice itself, their eyes, and it was like a flashback, and it was as if I could just see my dad's eyes, the way his eyes were when he was ill. And just thinking back, oh my God, that's how my dad would have felt. Like as a child at 8, I might not have been really able to understand it, but as a medical student, I was able to see it more, and knowing that that is what he must have gone through and felt, that was really hard at that time. I ended up not being able to really vocalize and engage in the placement itself, and even the consultant noticed this. So straight after the placement, I thought, okay, I really need to learn how to deal with this. I went to see my tutor, who suggested that I go and talk to the counselor, and I did that. And after about 2 sessions or so, I felt okay, and then afterwards I chose a module to actually do in that department, and I was able to do it. The best thing for me was to not to run away and just face with it and just repeatedly seeing it and pushing myself so that I can actually do it and know that I can do it. And I'm really, really grateful for the university and the medical school, because every time I needed to talk to somebody or needed any help or support, they've always been there. What I've learned is that grief is not something you start and have an end point. And this I have come to realize, especially since starting med school, where I've been faced with a lot of patients in difficult situations, and also reminding me of my dad as well. So every time I'm faced with it, it sort of takes me back to those days and reminds me of everything. And that makes me realize that actually this will be there for the rest of my life, but I will just have to figure out how I deal with it. I feel like grief or bereavement, or even any other mental health issues or any problems a student might have, even with those, call it a baggage, even with any sort of baggage, you can have a dream and you can move forward. You just need to push yourself and you can actually do it. In a way, I really want to inspire people, and that's one of the biggest dreams I have. And with it comes my dream to become a good doctor and practice medicine, and I really love and enjoy medicine.